Module 3, Theories of Addiction. Why do individuals use substances or engage in behaviors that they know have a tendency to become addictive? In this module, we will answer that question by discussing several theories of addiction in more depth. Before watching this lecture video, you should have read Chapter 4 in your textbook, which covers Etiology of Addiction, Why People Use. In this lecture video, we will focus on going over several models of addiction not previously covered in your textbook, including the academic model, the Diathesis-Stress Model, and the process model of addiction. Before we do that, we will go over the moral model of addiction in more depth, specifically focusing on how professionals use this model in treatment today. As your Chapter 4 reading should have shown you, there are a multitude of models of addiction that exist today. These models have been created to help provide an explanation for why an individual uses an addictive substance or behavior and where the behavior originates from. The different models have an impact on the way a professional would work with an individual with an addictive disorder and have important implications for the way we as individuals think about addiction today. Etiology explains the why and the where. Why the individual with an addiction drinks, drugs, or acts in a certain way, and where the individual with an addiction's behavior originated from. Before moving on to the next slide, I'd like you all to take a minute to think about, is there a right or a wrong theory of addiction, and how would we know? The first model that we'll talk about in our lecture video today is the moral model. Again, the moral model is talked about in detail in your Chapter 4 reading, but we will review it carefully here today as well. Through the moral model, addiction is viewed as a weakness of moral character or of personal will. The moral model emphasizes that a person with addiction is just too weak to say no. This model has a lot of strong debate and is one of the oldest theories of addiction and is a common reaction to addiction by individuals who have not had education on addiction, such as family members of an addicted loved one. This model assumes or emphasizes the power of personal choice, willpower and desire to abstain, a lack of spiritual choice, thus the behavior is viewed as being sinful, and that addiction is a violation of social norms. This model urges the addicted individual to take personal responsibility for their actions. What these assumptions then lead one to believe is that an addict can be held responsible for their inability to quit, that in order to move into recovery, the individual need only to decide that they want to quit. This viewpoint is also commonly taken towards sexual offenders and mental illness. Think about the examples of telling someone who is depressed that they just need to snap out of it or get up and get ready for your day. That will help you feel better. As individuals who have taken courses in addiction and recovery, this model likely seems silly or inappropriate, and you probably think, why is this model even acknowledged today? What is important is that we can use this model to normalize a family member's initial reaction to their addicted loved one by educating them on this model and where it came from. Professionals today still use some of this model in treatment in terms of helping individuals to understand the power of personal choice. Not that addiction is as easy as making better choices, but that the choice is a part of the treatment process and the importance of also addressing spirituality during treatment. The next model that we'll talk about today is the academic model. This model is not covered in your textbook, so please be sure to take careful notes as we go through this model. This model is founded on the assumption that addiction is caused by the body's adaptation to continued use of addictive substances or behaviors, which is seen at the biochemical and cellular level of the body. The model states, given enough of the substance or enough time engaging in that specific behavior, an individual will become addicted. The body must adapt to the toxic effects of the drug at the biochemical and cellular levels in a process called allostasis. Please be sure to remember what allostasis is, as this is an important key assumption of the academic model. When taken a drug, the drug will then disrupt the homeostasis of the body, particularly one's brain chemistry. If a person is given sufficient amounts of drug for enough time, their body and brain will change as an adaptive mechanism. The attempt to then rebalance leads to long-term changes that will reinforce the addiction. The model states that you will see specific physiological changes such as tolerance, tissue dependence, withdrawal symptoms, and physical dependence. And we will go over each of these now on the next slide. We will now look at the 4 aspects of the academic model that talk about the physiological changes that happens in one's body during the addiction process. First, tolerance. Tolerance results from the body's attempt to eliminate a drug that it treats as a toxin, and with continued use of the substance or behavior, the body tries to neutralize the toxic effects by requiring larger amounts of the drug to achieve the original effects. The degree of the effects depend on several factors, such as amount of the drug used, duration of use, frequency of use, an individual's chemistry, and their state of mind. So again, tolerance is that need to use more and more and more of a substance to get that desired effect that they originally felt during those first times of use. Next, we'll talk about tissue dependence. After tolerance becomes tissue dependence, this is the biological adaptation of the body to the drug such that the body comes to depend on the substance or behavior to stay in balance. The tissues and the organs of the body come to depend on the drug to stay functional. A good example of this would be the alcoholic who needs a drink to prevent their hands from shaking, or the heroin addict who needs to use to prevent headaches and body aches from occurring. Third, we have withdrawal syndrome. This is the unpleasant effects that follow the cessation of drug use as the body attempts to restore its chemical balance. Some withdrawal symptoms can be so severe that the user will continue to use drugs to avoid having to experience these painful symptoms. Withdrawal symptoms can also be dangerous to one's health, depending on the substance of abuse, and an individual may need medical monitoring while their body is restoring itself. Some examples of withdrawal symptoms may include emotional impact, sweating, headaches, vomiting, diarrhea, body aches, tremors, and flashbacks. The final piece that we'll talk about with the academic model is psychological dependence. This is the result from the action of the substance or behavior of abuse impacting brain chemistry and the individual feeling the need to continue to use for emotional stability. The pleasurable effects of their using reinforces the desire to use, and this is recognized as an important motivating factor in developing an addiction. We will now move into talking about the Diathesis-Stress Model. A diathesis is a predisposition or vulnerability to develop a given disorder under certain conditions. The Diathesis-Stress Model really looks at both the biological predisposition and how that is also impacted by environmental factors, so that nature-nurture debate that we hear a lot about in psychology. The person who has a predisposition will have the genetic and environmental factors combined with both the availability of the drug or the practice of certain behaviors. Genetic influence varies depending on different factors such as the substance of abuse. Environmental risk factors can include physical, sexual, emotional abuse, stress, nutrition, living conditions, familial relationships, healthcare, school quality, peer pressure, and economic factors. Any of these or all of these may exist that can be environmental risk factors that can increase the likelihood that an individual will develop an addictive disorder. These predispositions are aggravated or triggered due to stress and substance use or engaging in a compulsive behavior. When the individual becomes stressed, the brain changes to the point where ceasing use may be very difficult. In other words, the addiction has then developed. It's important with the diathesis-stress model to acknowledge that the stronger the diathesis, so either the higher likelihood that they have a genetic predisposition, or the more environmental risk factors that they experience in their lifetime, the fewer the drug or less acting out is actually needed to push the person into addiction. So again, another way of saying this is the more likely they are to experience genetic and environmental risk factors, the less amount of drug or behavior they need to actually engage in for that addictive disorder to actually develop. Before moving on to the process model of addiction, I want to show what the actual diathesis-stress model looks like written out. I'm not going to read through this. There's a lot of information on this slide, so I'm going to give you a few minutes now to go over this and look through each of the different aspects of the model with the accompanying examples. Let's move on to cover the process model of addiction. The process model of addiction was created by Dr. Kitty Harris in 1995 and focuses on the systemic and developmental nature of recovery. This model is not covered in your textbook, so we will spend a larger amount of time discussing this model in today's lecture. The primary assumption of the process model of addiction is that everyone experiences pain in life and that this pain causes discomfort or turmoil. An individual will choose how to react to the pain, either through a cycle of compulsive behaviors or through coping. The process model of addiction and recovery then assumes that if an individual does not have enough protective factors when pain is present in a system, then that individual will engage in compulsive behavior and substance abuse, and dependence will then occur. This model is based on how an individual copes and the use of protective factors to build resiliency. Another important assumption of this model is that the longer an individual spends in the cycle, the harder it is for them to break out of that cycle. For example, the longer an individual stays in the compulsive cycle or negative coping, the more difficult it will become for someone to move into the process of recovery where they are utilizing positive coping mechanisms. This model then illustrates active addiction and recovery based on coping techniques. The first part of the model that we'll talk about is pain. Again, that primary assumption of the process model of addiction is that everyone experiences pain. And this could fit into different categories. So physical pain, an individual has chronic pain, they have a back injury, they have other ailments like MS, something that causes them to feel physical discomfort. They may have mental pain, they may have emotional pain, or they've experienced rejection, disappointment, anger, betrayal. They may have social pain where they feel loneliness, isolation, abandonment, or it could be spiritual pain where they feel like they have a lack of purpose in this life or a general emptiness. We can look at pain as being the trigger for engaging in either those compulsive behaviors or engaging in those. After pain is experienced, an individual is then forced to decide how they will choose to react to the pain. On the compulsive side of the model, the individual will lack those positive coping skills which will lead them to engage in compulsive behaviors to manage the pain. Examples of compulsive behaviors that an individual may engage in could be the use of drugs or alcohol, or engaging in a number of many different types of process or behavioral addictions, such as compulsive exercising, eating disorders, sex addiction, compulsive gambling, compulsive shopping, hoarding. All of these fit into that idea of compulsive behaviors that an individual may use to manage the pain. If the individual repeatedly turns to the addictive substance or behavior, this can then turn into a compulsive use or an addictive disorder. In the early stages of substance use, an individual may report feeling normal for the first time. The feeling of normality will initially bring some relief to the individual in terms of their discomfort or pain. However, this normality does not always last. And so what we see happening next in the compulsive cycle is that the individual will experience negative consequences due to their compulsive behaviors. We can look at types of consequences as falling into 5 categories. These include health, such as feeling ill, cirrhosis of the liver, or decreased brain functioning, issues with relationships, such as discord with their parents, spouse, or significant other, friends, or siblings. The third category being employment of school, where they might have experienced a loss of their job or doing poorly in school as a result of the compulsive behavior. They may have financial consequences, such as bankruptcy or debt. And then finally, legal issues or healthcare issues, such as driving while intoxicated or receiving different citations or possibly prison time. It is important to remember that not all individuals will experience all 5 types of consequences. An individual will, however, be very likely to experience at least one of these negative consequences during their compulsive behavior use. The 5th stage in the cycle is going to be guilt and shame. Guilt is feeling bad about what you do, and shame is the feeling you have about who you are. According to the model, an individual will likely feel guilt and shame due to the negative consequences that they faced, which will then lead to more pain and the repetition of the cycle. It is due to the recursive nature of the cycle that one can understand how difficult it can be for an individual to break out of the cycle and move into the coping cycle. This compulsive cycle will continue to repeat itself until the cycle is broken. Let's talk a little bit about how an individual may be able to break out of the cycle. First, we can look at treatment professionals. Treatment professionals often work with the individual to help them learn new ways to cope with the pain and to help prevent the compulsive behavior from being the only way that the individual knows how to cope. They can help the individual identify triggers, barriers to using positive coping behaviors, and provide them with professional care to deal with the addictive disorder. So as you can see on our model, we have a line drawn that treatment professionals will tend to intervene right between when the pain happens and prior to engaging in that compulsive behavior. So in terms of treatment, that's where the treatment professional is going to be focusing. Another process of intervention could be the community and society. So if we think about negative consequences that come with compulsive behaviors, we could go back to those 5 categories of negative consequences that one might experience. In terms of community and society, what might be some examples of consequences that they experience where you might see community or society intervene? So let's use the example of an individual that gets a ticket for driving while intoxicated. The individual may go to court and receive punishment of going to driving school or the recognition that the individual has an addictive disorder that they need to treat in order to be able to get their license back. So the community or society may be intervening during those consequence times where the driving citation may lead them to have to seek treatment that helps them get out of this compulsive cycle of use. We also could see jail time as being another example of community or society intervention. Next, we can talk about how the family may be a part of the process of intervention. Family and friends typically step in and intervene during the guilt and shame stage. When loved ones learn to understand addictive disorders and can move beyond that moral model, they learn how to interact with the individual living with an addiction in non-shaming and non-guilting ways, which can then help reduce the person's pain and help stop the cycle from being repeated. We can now look at the process of recovery. Again, pain, everyone experiences pain. That is a primary assumption of the process model of addiction. So once an individual has stepped out of the compulsive cycle and started the process of learning how to be resilient in the face of pain, they will move into the coping cycle. This does not mean that an individual will no longer feel pain. It means that an individual will build new protective factors that help them prevent them from using the negative compulsive behaviors they previously were using. So again, they could feel pain in any of the 5 categories that we discussed earlier. Next, the individual is going to move into coping behaviors. Individuals will have to practice building healthy coping mechanisms to deal with pain. Some of the coping mechanisms that are identified as being most beneficial to recovery include anger management skills, communication skills, problem-solving skills, decision-making skills, education, relationship skills, and financial literacy. Other things that we might talk about with clients as a professional would be learning how to talk with someone whenever they're feeling stressed or experiencing pain. Maybe it's working with a dietitian if they're engaging in eating disordered behavior, journaling, going on a walk, and learning how to meditate. The third aspect of the model is self-esteem, a feeling of respect for oneself, being confident or satisfied with oneself, or a person's overall emotional evaluation of his or her own worth. As the individual continues to have success in using their new positive coping behaviors and refraining from engaging in old compulsive behaviors, the individual will begin to rebuild their self-esteem. They report feeling better able to respect oneself, being confident and satisfied with who they are, and a more positive view of their worth as a person. Overall, an individual who has started to rebuild their self-esteem will start to build confidence in themselves and their ability to be successful in the recovery process. The fourth piece of the cycle that we'll talk about then is positive consequences. So you can see as we've moved away from the compulsive side to the coping side, negative consequences has been replaced by positive consequences. With the individual's increase in confidence and self-esteem, this will ultimately lead to positive consequences from the changes they are making in their life. The same 5 categories of negative consequences will remain here for the positive consequences. So we may begin to see improvement in health as the individual has ceased using those compulsive behaviors. They may be rebuilding relationships that were previously impacted negatively by the compulsive behaviors. They may be re-experiencing new achievements at work or at school. Financially, they may be learning to better manage their finances and not spending money on those compulsive behaviors. And they may be getting out of legal issues or having better access to health care. Finally, as this happens, the individual is going to start to rebuild resiliency. Resiliency is one's ability to recover from the strain of the negative situation or to overcome obstacles despite their impact on an individual's life. The more and more an individual is able to address their pain in positive ways, the greater accumulation of resiliency they will have. The more supportive their environment or family system becomes, the more likely they are to be able to remain in the coping cycle or to successfully leave the compulsive cycle. Now, let's take a look at the model all together. So we see here we have on the left side of the screen the compulsive model, and on the right side the coping model. And now if we put them together, we can see the addiction side of the model on the left and the recovery side of the model on the right. And down the middle of the model, we can see those common experiences that tie those two cycles together. So always starting with pain, and then a selection of the behavior that an individual is going to engage in, either compulsive or coping. Their response either being for the first time they're feeling normal, or they're now starting to develop self-esteem, then leading to a consequence either negative on the addiction side or positive on the recovery side, and then the ultimate results either being those feelings of guilt and shame, which lead back to the start of the model of feeling pain, or resiliency developing, and that leading to positive ways of then addressing pain the next time it happens. In conclusion, in this lecture video, we reviewed the moral model of addiction, which was also covered in your assigned reading for Module 3. The moral model is outdated based on current research. However, many families who enter treatment with a loved one will indicate that they believe that their loved one just does not want to quit or isn't trying hard enough. And we as professionals can use the moral model of addiction to validate their feelings and provide helpful psychoeducation about what we know today about the power of addictive disorders. This lecture video also discussed the academic model, which focuses on the physiological responses our bodies have to addictive substances, and the Diathesis-Stress Model, which looks at the role of both genetic and environmental risk factors paired with stressors in life or the access to substances of abuse. The primary focus of today's lecture was on the process model of addiction, which explains how individuals respond to pain either by engaging in compulsive behaviors or using positive coping cycles which keep them in that resiliency and recovery stage. A reminder that the longer a person stays on one side of the model, the harder it becomes for that individual to leave or to develop positive coping skills. After completing this module, you should complete the case activity assignment and your module quiz, which are both located in the content folder for Module 3. These assignments will both be due at the conclusion of Module 3. Please don't forget to turn those in.